Hey, Dada,
Hey, what's up?
what's the Glasgow Coma Scale?
The Glasgow Coma Scale? All right, so the Glasgow Coma Scale is an assessment tool that we use to verify the patient's neurological activity and to see how deep into a coma they are, how reactive the nervous system is to external stimuli. There's three components that we assess: your eye-opening ability, your verbal ability, and your motor function. Each of those elements or each of those assessment parameters contain a max of a certain amount of points. So for instance, your eye-opening ability, a max of 4 points. Your verbal ability, a max of 5 points. And your motor function or your motor ability, a max of 6 points. So just keep in mind that it's 4, 5, and 6 as a max. So when the patient opens his or her eyes spontaneously, that patient gets an automatic 4. If you have to talk to the patient for them to open their eyes, that's a 3. If you have to use some type of physical stimuli to get the patient to open their eyes, then that's a 2. And if they're not opening their eyes at all, that's a 1. Then when it comes to their verbal ability, if they're alert and oriented and they're responsive, that's a 5. If the patient is confused, that's a 4. Now, if the patient is articulating words, but their words don't make sense. I mean, you know what they're saying. They're saying like, the house on the peach is below the ground because of the purple acres. Like, what does that mean? That's going to usually be a 3. If the patient normally has garbled speech or just makes sounds like, things like that, then that's a 2. Incomprehensible words or words just sounds, that's a 2. And if they have no verbal response, that's a 1. And then for their motor function, well, if they can follow commands and they can elevate their arms and if they can do everything that you're asking them to do, well, then that's a 6. If the patient can only move to localize pain, so for instance, if they have a shoulder injury and they're not moving at all and you don't know what else is going on with them, right? But in order for them to, for you to, when you start assessing that shoulder with the injury, and that's what makes or provokes the movement, that's a 5. If the patient has the same injury, the nurse is assessing it, and while the nurse is assessing it, all they can do as a reflex is move away from the pain, that's a 4. And then we start getting into posturing. If the patient has a posture of decorticate, where their arms and legs and feet got kind of like are angled towards the core of the body, decorticate, that's a 3. That's a problem because that means that the brainstem's being affected. It's being squeezed. There's some type of damage there. If the patient has decerebrate, where their arms are outward and their feet are pointing stiff forward in this fashion, that's a 2. That's also a more concerning damage to the spinal cord, so it's worse than decorticate. Decerebrate is worse than decorticate. Anyway, so decerebrate, that's a 2. And if the patient has no movement response whatsoever, then that's a 1. And that's a Glasgow Coma Scale. A max of 15 points, a minimum of 3, and the goal is to hopefully the patient has above 8 points. That's usually reassuring. Anything that's 8 or less, it's usually indicative that something's going on neurologically. The patient's in some degree of coma. And I hope that makes sense.
Thank you.